Hello everyone, welcome to today's session. So we'll start with our today's question. The nurse is caring for a client receiving IVPB azithromycin. Which client data obtained by the nurse should be reported to the healthcare provider prior to administering the additional doses? So the question is directly asking to us, which of the client data should be informed to the doctor while administering the additional dose of azithromycin? So we'll see what are the options. Option 1 says currently nauseated and vomited once, decreased white blood cells count, prolonged QT interval, temperature of 101.4 degree Fahrenheit. So out of this option, which is the one could inform to the healthcare provider before administering another dose of azithromycin? What do you think? So we know that azithromycin is antibiotic which belongs to macrolide antibiotic group. So what are the macrolide antibiotics? Another one like erythromycin, clarithromycin. So these type of macrolide antibiotics, it can lead to some kind of severe life-threatening arrhythmias like Torsades de points. We studied these arrhythmias while we are discussing the ECG topic. So the nurse should observe for the prolongation of QT interval. So if the prolongation of QT interval which leads to the Torsades de points, that is one of the life-threatening arrhythmias. So if the nurse is noticed this one, she should inform to the healthcare provider then and there, so we can hold the next dose of azithromycin to prevent the consequences, because it's a serious consequences. And another option says like currently nauseated and vomiting. That one we know that some of the expected common side effects of azithromycin. That is not something necessary to hold the additional doses of medication. And the decrease in WBC count, which means that the infection rate is resolving or the infection is resolving. Then the other one, fever. That fever, it can be present along with the infection. Anyway, the client is taking the azithromycin and the nurse can inform the doctor the temperature. So based on that, the acetaminophen doses can be taken with the precautions. So these are some of the points related to this azithromycin. So we said that azithromycin, it's an antibiotic which belongs to macrolide antibiotics. So what are the main consequences of this macrolide antibiotics? That is the prolongation of QT interval, and that is related with the Torsades de points. So I hope it's clear, and it's a very simple topic. I just wanted to include this topic because many of them have a doubt, and some of them choose the wrong answer. Some of them go with the decreased white blood cell count, and some of them go with the temperature. Nausea and vomited, everybody knows that is the expected side effect, so we usually never choose that one. So the correct answer of this question is option 3, prolonged QT interval. If the nurse saw this option, or the nurse while she collecting the data, if she saw this one, she should immediately inform to the doctor. So that's it.